First aid of bleeding. First aid of internal bleeding. 1. Bruise, contusion. Apply ice or cold pack with cloth to prevent damage to skin to reduce pain and edema. 2. Severe internal bleeding. Call local emergency number. Monitor ABC. Treat for shock. Place casualty in comfortable position. Maintain normal body temperature. Reassure casualty. First aid of external bleeding. 1. Apply direct pressure. Place a dry, sterile dressing directly on wound and press on it with your gloved hand. 2. Elevation. If direct pressure doesn't stop external bleeding from an extremity, elevate injured arm or leg as you maintain direct pressure. 3. Pressure point. If combination of direct pressure and elevation doesn't control bleeding from an arm or leg wound, you must try to control it indirectly by preventing blood from flowing into limb. This accomplished by compressing a major artery against bone at a pressure point. First aid of nose bleeding. 1. Make patient sit down with head forward. 2. Pinch nose below bridge for about 10 minutes and avoiding speaking, swallowing or coughing. 3. Ice packs over nose. 4. If bleeding doesn't stop, repeat nose pinching for another 10 minutes. 5. If bleeding still doesn't stop, seek immediate medical help. 6. If bleeding stops, ask patient to avoid blowing nose. 7. Don't insert any object, medication in nose. Types of bleeding. 1. Internal. 2. External. A. Capillary. Slow and oozing. Easily controlled. Stops spontaneously. B. Venous. Steady flow. Easier to control. Low pressure system. C. Arterial. Rapid and profuse. Spurting with heartbeat. Most difficult to control. Shock. Definition: failure of circulatory system. Causes of shock. 1. Pump failure, cardiogenic shock. When a heart pump fails to work properly, causing down-pointing arrow in pressure of blood. 2. Pipe failure, caused by dilatation of capillaries 3 or 4 times their normal size. This causes blood to pool in capillaries instead of circulating throughout systems, so decreased blood pressure and shock results. 3 types of shock caused by capillary expansion are: fainting, psychogenic shock, anaphylactic shock, spinal shock. Anaphylactic shock, caused by extreme allergic reaction to a foreign substance such as venom from bee stings, penicillin, or certain foods. Spinal shock, occur in patients who suffered from spinal cord injury. 3. Fluid loss. Shock develop as a result of reduction in volume of fluid circulating around body as bleeding, diarrhea, vomiting, or burns. Recognition of shock, signs and symptoms of shock. 1. Initially, a flow of adrenaline causes rapid pulse, pale, gray skin especially inside lips, sweating and cold clammy skin, sweat doesn't evaporate. 2. As shock develops, there may be weakness and giddiness, nausea and sometimes vomiting, thirst, rapid and shallow breathing, a weak pulse. 3. As oxygen supply to brain weakness. Casualty become restless, anxious and aggressive. Casualty may yawn and gasp for air hunger. Casualty will eventually become unconscious. Finally, heart will stop. General first aid of shock. 1. Position of patient correctly. If there is no head injury, extreme discomfort discomfort or difficulty breathing, lay patient flat on back on a horizontal surface. Place patient on a blanket, if available. Elevate patient's legs to 12 to 18 inches off floor or ground. This enables some blood to drain from legs back into circulatory system. If patient has a head injury, don't elevate legs. 2. Maintain patient's ABCs. 3. Treat cause of shock if possible. 4. Maintain patient's body temperature. 5. Make sure patient doesn't eat or drink anything for 2 reasons. A. Patient in shock may be nauseated and eating or drinking may cause vomiting. B. Patient in shock may need emergency surgery. Patients shouldn't have anything in their stomachs before surgery. 6. Assist with other treatments. 7. Arrange for prompt ambulance transport to an appropriate medical facility. Shock treatment. 1. Place victim in shock position. 2. Keep person comfortable. 3. Turn victims to one side if neck isn't suspected.